experts urging lawmakers to fight the growing drug crisis fueled by fentanyl. More than 2/3 of all overdose deaths in the U.S. are now due to fentanyl, the highly potent and deadly drug being laced into other substances sold online. The Senate committee heard from experts from the CDC, Health and Human Services, and the White House about what they're seeing.
We've never seen an illicit drug supply that is so potent, unpredictable, or lethal.
The experts said a majority of the synthetic opioid comes from China and Mexico, but is also coming to the U.S. through the mail and through ports. Bipartisanly, lawmakers say there needs to be better screening.
Major depression is one of the most common mental disorders in the United States. Many people are taking prescribed antidepressants to help the chemical imbalance that was believed to be the cause of the disorder up until recently. New research shows that the decades-old theory is not supported by evidence. Joining us now to explain this bombshell report is psychiatrist and Odyssey Behavioral Healthcare Chief Medical Officer, Dr. Daniel Bober. Dr. Bober, good morning.
Good morning.
So what does the research show?
Well, this was something that was really pushed in the late 80s by the pharmaceutical industry and unfortunately by many of the professional societies. People believe that depression is simply an on-off switch and that if you change chemicals in the brain, specifically serotonin, that it's going to make it go away. And we know that depression is so much more than that. There are so many different neurotransmitters in the brain, including the glutamate system, that are involved. But it's also things like biochemistry, genetics, early childhood trauma. Depression is not letting go of the past, worrying about the future, and the inability to live in the present moment. So there's so much of it that really depends on multiple factors. So you can't really, reduce it down to one thing like serotonin.
So what do these new findings mean for treatment?
It means that we have to use all modalities available. For mild to moderate depression, therapy works very well. It has very high efficacy. There's a type of therapy called cognitive behavioral therapy, for example, that shows equal efficacy to antidepressants. So my motto is always skills, not pills. Try therapy first, and if that doesn't work, go to medication. There's also other things on the horizon, like we know the role of inflammation is very important in depression. And of course, psychedelics like psilocybin are looking to revolutionize the field of psychiatry. So there's a lot of things out there that we can try without just turning to a pill.
So for people who have been taking the pills and swear by them and say, I do feel better when I take them, have they been acting as placebos for all this time, or?
There is a large placebo effect with antidepressants, but we know that they are somewhat effective, marginally effective. So if it's working for you, stick with it. Any changes in your medication, you should discuss with your doctor. But we have to look at other things because at the end of the day, we don't know exactly what's causing depression. We have some theories, but it's still a work in progress.
That's because there's depression and then clinical depression. And I don't think people always understand the difference between the two.
Absolutely.
Well, thank you so much, Dr. Bober of Odyssey Behavioral Healthcare, the Chief Medical Officer. A very enlightening study, and I encourage people to read it for themselves. Take care.
Take care. You too. My pleasure.
All right. It's 7:20.